Greetings, colleagues, to the Global Coalition to Address Synthetic Drug Threats. This is a special meeting of the Working Group number 3, which is focused on public health measures. I have a few administrative announcements to get through, and then we will begin our session for today. First, I want to thank everybody for your dedication to all of these months of meetings. Our coalition now has over 1,500 participants from 149 countries, and through the sub-working groups, we have covered 70 hours of sub-working group meetings. So I'm very appreciative of your dedication to this process. The goal of today's session is to discuss the progress that has been made over the past 6 months since the last working group meeting, which took place in September. We are going to review the draft recommendations that we have now collected edits from our colleagues. We are going to invite additional comments before these recommendations are posted on our coalition website. As a note, I want to highlight that governments do not need to adopt all of the recommendations that are presented, and governments can also implement other recommendations outside of these as well. If we don't have enough time to finish, and this session will be particularly challenging because we have 3 sub-working groups, no worries, we can continue the discussions in April through our sub-working group meetings. I also want to share that beginning in April, we will be looking at the implementation of the initiatives. So please continue to visit our website and identify initiatives that may be of interest and write to the international organizations to express your interest in participating. How does that work practically? Well, here's a screenshot of our coalition website. You see in circle the initiatives tab. If you click on that menu item, you will then see a listing of initiatives. When you click on an initiative of interest, you will receive a description, background, you'll have information on outcomes, and at the very end, you will have contact information for who you can reach out to express your interest in participating. So please do so and email those colleagues from the international organizations that are managing the respective initiatives of interest. So I'm going to stop sharing my screen now. I will take this opportunity to say for those attending the Commission on Narcotic Drugs, the CND, in a few weeks, that we will have a couple of meetings on the Global Coalition, one that will be a donor coordination meeting, and another one that will be focused on general preparatory work of going from recommendations to initiatives and operationalization of our work. Now, I'd like to turn it over to the co-chairs for working group number 3. And first, I'd like to recognize and thank Stephanie Williams, the Ambassador for Regional Health Security, who has moved on to another post. Lucas de Toco has taken over. Not sure if he's on today, but I also see Secretary Catalino Cui, the chairman of the Dangerous Drugs Board of the Philippines. So I will turn it over to him, and also to Mr. Lucas, Ambassador Lucas de Toco, or anyone that may be acting in his stead from the Australian side. So Secretary Cui, over to you first, sir.
Thank you very much, Brian. So good morning for those in daytime, and good evening to those spending the nighttime. I am delighted that despite the differences in our time zone, we still managed to convene meaningful sessions such as this. As the chairpersons of the Philippine Dangerous Drugs Board and one of the co-chairs of the Working Group 3, I would like to acknowledge and thank my co-chair, Mr. Sin Starmer, the acting secretary, assistant secretary in the Department of Foreign Affairs and Trade of Australia, in place of Miss Ambassador Williams. Over the past months, our coalition has made significant impacts in addressing the synthetic drug crisis. In the third working group, our focus is on promoting public health interventions and services aimed at the prevention and reduction of drug use, overdose, and its related harms. We recognize that prevention is important in addressing drug abuse and dependence. All the sub-working groups under Working Group 3, namely the Sub-Working Group 3.1, Preventing Drug Use, Strengthening and Expanding Evidence-Based Prevention and Activities. The Sub-Working Group 3.2, Engagement with People with Substance Use and Substance Drug Abuse Disorders. And Sub-Working Group 3.3, Populations in Contact with Criminal Justice Systems, including alternatives to incarceration. So, all the sub-working group under sub-working group 3 laid out a range of initiatives designed to prevent the illicit manufacture and trafficking of synthetic drugs, to detect emerging drug threats and use patterns, strengthen prevention efforts, and engage individuals with substance use disorder. The coalition represents a convergence of diverse experiences, each stemming from unique paths, yet collectively taking a moment to bring together our varied expertise, exchanging experiences, trends, and solutions to figure out the best way forward. This international cooperation would bring so much to the table in our fight against synthetic drug threats. The collaboration defied boundaries and differences in order to address a common problem and learn from one another. Reflecting on our initiatives, the progress has been notably positive thus far. Hearing about the significant impacts and success of programs within this coalition, it is evident that our hard work since the beginning has borne fruits. Continuous improvement is crucial as we tackle synthetic drug threats amidst the ever-evolving times and trends. By brainstorming and consolidating the expertise and resources of our coalition members, I'm confident that we can make a difference in achieving our mutual goal of securing safer and healthier nations, which makes the world a better place to live in. And I want to thank the United States Department of State and International Narcotics and Law Enforcement Affairs for creating this and bringing nations together to join this initiative. This would have been just a blueprint without your action. May I likewise acknowledge and recognize the impressive efforts of the sub-working group co-chairs, such as Dr. Maria Corazon Dumlao, Ivana Teresine, Dr. Yatan Palsing Balhara, Dr. Risa Sarasbita, Attorney Aris Manguera, and Dr. Daulat Baypesok. Thank you for your excellent work and for being part of the team. I would also like to express our appreciation to each and every one for your commitment. Together, we have the chance to impact the lives of millions affected by synthetic drug abuse. Let us grab a hold of this opportunity to openly discuss strategies, adapt best practices, learn from each other, and work with one another. May our continuing sessions continue to fill in the gaps, yield ideas for program improvement, and strengthen the avenues of collaboration. Thank you very much.
Thank you so much. And my apologies, Mr. Starmer, I had the wrong name. I understand that you are now replacing Ambassador Williams. So welcome. It's such a pleasure to meet you. Thank you so much for your participation today, and look forward to also hearing from you. Over to you.
Thank you very much. I'm delighted to be here and to join this very significant and important effort. I recognise my esteemed co-chair, Secretary Coy, and Australia very much welcomes this opportunity to co-chair the second meeting of Working Group 3 with the Philippines. I also acknowledge the leadership and significant effort from our colleagues in the US in relation to this initiative. We're heartened to see such a large number of participants in the coalition, including from Australia's region. Bringing so many countries together on this issue is an extraordinary achievement and reflects the importance and the urgency of this issue. Australia sees this coalition as an opportunity to share information to address the many problems caused by the rapid increase in synthetic drug use and to deliver tangible outcomes that make a real difference in reducing the far-reaching impacts of synthetic drug use on individuals, on families and communities at domestic, regional and international levels. We also very much welcome the inclusion of public health focused efforts and initiatives as a main work stream for the Global Coalition. Australia is committed to preventing and minimising the harms of synthetic drug use. We've greatly valued sharing our experiences with this group and working together to respond to this challenge. As with many other countries in our region, Australia remains concerned regarding synthetic drug use. Methamphetamine and other amphetamine use in particular is an issue for us domestically, but we know this problem is also shared by countries in our immediate region in Southeast Asia and the Pacific and more broadly. Australia has also identified opioids, new psychoactive substances and non-medical use of pharmaceuticals as priority substances for our 10-year national drug strategy. We're concerned about the rise in the use of synthetic opioids, understanding that the harms are significant and that the manufacturing, production and trafficking of these substances are ever evolving. We strongly support efforts in this group to ensure that prevention, treatment and recovery can be addressed in ways that effectively balance health, law enforcement and human rights approaches and priorities and address the social determinants of health. We're very pleased to have been able to participate in the working groups, the sub-working groups over these past months and to share our experiences. Australia's national drug strategy outlines our national commitment to preventing and minimising drug-related harm. We remain focused on expanding access to medicines and healthcare and improving the quality of treatment for drug use, to strengthening and expanding evidence-based policy responses to support prevention, treatment, recovery and management, and to promoting alternatives to incarceration. Importantly, Australia ensures that due consideration is given to the communities and populations who are at disproportionate risk of harm, and the relevant health services and programs are available in a variety of settings and are adapted to meet population-specific needs. We also welcome the involvement of civil society and organisations in the sub-working groups. We acknowledge the importance of working collaboratively across sectors, including with the affected communities themselves, in developing, implementing, monitoring and evaluating initiatives and responses. I want to pause and acknowledge the significant progress that we've made since the first working group meeting in September 2023. To give a brief overview of the significant amount of work, the first phase of work in October 2023 with the meeting of 7 sub-working groups, totaling more than 14 hours of meetings between the East and West sessions, with sub-working group chairs facilitating robust discussions regarding the objectives, the challenges to be addressed and how each group would measure progress. A second phase of work between November 2023 and February 2024 of monthly sub-working group meetings featuring presentations showcasing specific global programs and projects, the considerations of government's adoption and participation. Collectively, we've identified gaps in global architecture, new initiatives were conceptualised and policy recommendations were developed to improve how some international systems, processes and tools can work together to make better progress. One indication of the scale of the effort by the sub-working groups is the large number of recommendations that have been put forward for our consideration today. And on behalf of Australia, I extend my thanks to the dedicated work from sub-working group members over that time. We're looking forward to discussing the recommendations and we hope to be able to reach agreement on a final list or at least narrow down a number that need further discussion at the next sub-working group meetings. Thank you very much.
Thank you so much for your comments as well. Indeed, as you mentioned, the amount of recommendations from this working group were incredible. Working groups 1 and 2 combined had nearly 20 recommendations, and this working group came up with 30 recommendations, so quite exceeded expectations. Now, we also identified that some recommendations were cross-cutting and actually covered all the sub-working groups. So we actually uniquely in this working group pulled them out and have them as sort of overarching recommendations that cover all 3 working groups, sub-working groups. So I'd like to ask Sarah to put those overarching recommendations first on the board so that we can review those, and she'll just read through them so that we have interpretation, translate those into Russian. And then I will call on our sub-working group co-chairs for 3.1 East to then take over and present their discussions and recommendations. Sarah, please go ahead.
Absolutely. Here we go. All right. First, Cross-cutting, working group 3 recommendations. 18, improve the quality of prevention, treatment, harm reduction, recovery, and justice, such as alternatives to incarceration, ATI. Systems at both the national and local level, using training, mentoring, technical assistance, and sharing of best practices through professional networks and regional consultations. Number 19, upgrade the practices of workforce professionals and other actors / volunteers through workforce development, networking, professional exchanges, training, technical assistance, mentoring, and certification to align with international standards. Number 20, consider protective factors, social determinants of health and equity in addressing substance use, including specialized approaches as necessary in providing support for marginalized populations to result in tailored policy and/or service approaches. 21, identify opportunities to mainstream the issue of synthetic drugs into relevant global and regional forums. 22, develop, expand, and disseminate substance use research to better inform policy and practice in consultation with a wide variety of stakeholders, including people with lived experience. Number 23, educate communities and the public as to the latest science on substance use disorder prevention, treatment, and recovery, including accurate reporting in the media and promoting and using non-stigmatizing language.
Okay, so instead of opening up to discussion at this time, what I'd like to do is turn it over to our Prevention 3.1 Working Group co-chairs. They will give a background of how the sessions have gone over the past months, and then they'll read the recommendations for 3.1. At that point, after that's completed, I will pause the recording so we can enter a discussion phase. And if you'd like to comment on those prevention recommendations or the ones that Sarah just read, we can do it all at one time so that we don't lose time in that process. So with that, I'd like to turn it over to the co-chairs from 3.1, Preventing Drug Use, Maria Corazon Dumlao from the Philippines and Ivana Teresine from the Seychelles for their comments, reflections, and recommendations. Thank you.
Thank you, Brian and Sarah and the rest of the USINL team for this engaging platform. Special thanks to Dr. Joe of Colombo Plan and Dr. Wadi of UNODC, our IO coordinators for this SWG. Greetings, of course, to Secretary Kui and Ambassador Sim and other officials and esteemed focal persons from participating member countries. Welcome to the Sub-Working Group 3.1 discussion. The discussions were anchored on the UNODC standards, highlighting the different settings, target population, and evidence-based policies and standards applicable to the stages of development. I would like to request Ma'am Sarah to share the discussions 3.1 SWG. In November, we discussed about prevention systems level assessment, highlighting the 3.1. SWG 3.1.
Hold on, my PowerPoint got messed up. Just give me 1 second to get it right. 1 second, sorry.
Thank you. It's okay, Sarah. Take your time.
Should have it right now. 3.1 discussion.
All
Yeah.
right. So in November 2023, we discussed about prevention systems level assessment, highlighting the UNODC tool to orient drug prevention strategies and the Children Amplified Prevention Services, or the CHOPS, and also discuss professionalizing the prevention workforce training and certification on the Universal Prevention Curriculum Managers and Supervisors Series and UPC practitioners, and also had a discussion on community-based prevention interventions. And for each topic, our country testimonials highlighted their efforts on the different settings. In December 2023, we had a discussion on family prevention program, which highlights the range of family-based prevention interventions. And we had an exciting discussion on school-based prevention programs that underscored various dynamics in the school setting, impacting on behavior change of students and improving health outcomes. And also the workplace prevention, highlighting substance use prevention policies, employee assistance program, employee education, and health promotion. In January 2024, we discussed about media prevention, working with media, entertainment industry, and sports industry to promote prevention, advocacy, anti-stigma, and the global youth engagement. We have learned a lot from the country testimonials on advocacy, persuasive communication, social marketing, and youth mainstreaming in prevention work. In February 2024, the European Drug Agency Prevention Initiatives and the e-learning platform Platu was also presented, and we had an engaging discussion on the environment-based interventions and mainstreaming prevention to address stigma and discrimination. The country testimonials allowed us to reflect on what can be done and sustained in the different settings for prevention and how this can possibly be adopted and contextualized in our own setting. And we really appreciate the recommendations that will come after these discussions so that we can figure out how we can better implement evidence-based prevention interventions and policies in our own respective areas of And I'm turning over the floor to my co-chair, Ivana, to share the recommendations for Sub-Working Group 3.1. Over to you, Ivana.
Thank you, Maria. Good morning, everyone. So in total for 3.1, there were 9 recommendations. So 24, analyze national drug prevention systems and where relevant and in accordance with national legislation and regulations, ensure systems incorporate existing interventions and services, including at early ages of development, and align them with the NODC, WHO International Standards on Drug Use. It is to be noted, wherever you see the red, these are the latest amendments that have been made to the initial recommendation. 25, develop, identify appropriate, adopt, or expand evidence-based drug policies and targeted prevention programs in the areas of family, school, community, media, environment, and workplace prevention. 26, involve youth to harness their potential and influence, including through social media, as agents of evidence-based prevention responses, not only as recipients of it. Can I have the next slide, please? Okay, so 28, recognize the importance of collaborating with the media, especially social networks, journalists, communicators, and influencers to reduce the promotion of substance consumption and combat misinformation about synthetic drugs. Additionally, provide opportunities for training and stakeholders to enhance universal prevention efforts. 29, promote prevention at the local level as part of a comprehensive prevention system, providing information on the population's substance use and the preventive capacity of the area. This includes involving local political authorities, government agencies such as education, health, social affairs, culture, sports, and public safety, community groups, and local social organizations. 30, encourage the monitoring and evaluation of the implemented prevention programs and strategies, fostering the exchange of best practices among stakeholders. Okay, may I have the next slide, please? Okay, 31, identify and utilize information from groups focusing on the manufacturing and trafficking of synthetic drugs, data collection and analysis, information sharing, interagency collaboration, policy formulation, and engagement with individuals with substance use disorders to strengthen prevention responses further. 32, promotes the identification and use of data related to the incidence, prevalence, patterns, and consequences of synthetic drug use in all contexts to gain a deeper understanding of the phenomenon and enhance preventive interventions. And the last one, facilitate coordination, collaboration, and participation among different sectors and levels involved in preventing synthetic drug use at national and local levels. So those are the recommendations for 3.1. If we can stop the recording so that we can have the discussion, please. Okay, so in reference to the recommendation, you now invited for any comments that you may have, and maybe with the comments, you can also let us know if there are any recommendations that you think can be adopted or adapted at the level of your country. So the floor is open for your input. Okay, any comments? And like Brian has said, the comments, the feedback can be in relation to the recommendation that Sarah also presented before 3.1 presented this.
Здравствуйте.
Yes, go ahead.
Hello.
Hi.
Вы меня слышите, да? Благодарю вас. Do you hear me?
Yes, I can hear you, yes.
Здравствуйте. Меня зовут Тинатин Сагымбаева. My name is Tinatin Sagumbaeva. I am from the second group, and I would like to thank you for the work you've produced. I'm in my country deal with the prophylactics and prevention programs. We work with adolescents, and everything which you've mentioned is very interesting for me and my colleagues. And I think the 29th recommendation, which dealt with the youth and the programs which are based on the research and science development. In our country, this area is right now is developing very rapidly. We are focusing on prophylactics quite actively. Our Ministry of Health and Ministry of Education is focusing on that, and we would like to introduce the special events, which is a specific MOOC Olympic Games, Science Olympic Games competition, which includes all the school children. And we want to bring this topic to their attention. And I think that we are very happy that we've read those recommendations because we are going to follow them in our country, in our region. That was very helpful. Thank you again.
Thank you very much, ma'am, and all the best. Anybody else would like to share?
And a friendly reminder from your technical moderator that you can find the raise hand button if you click reactions.
Do you think those recommendations are applicable at the level, I mean, in your country? So it seems as if everybody agrees with the recommendation. You don't have any comments or any feedback or any changes. So on that note, I think I'll hand over to Brian since we don't have any more comments.
Thank you, Ivana. The consensus is encouraging. That's very encouraging, and we can move on to the next session then. Thank you, both of our co-chairs for Working Group 3.1. I now would like to invite our co-chairs from Sub-Working Group 3.2, engaging people with substance use and substance use disorders. We've got Yatal Pansing Balhara from India, and we have Amrita Devi from Indonesia to help in reviewing and reflecting on the past months and presenting the recommendations. Over to you both.
Thank you, Brian. Hello and a very warm welcome to all of you to this particular section of today's session. And before I take you through the discussions that we have had in our sub-working group, I must thank all the participants who have joined us over the course of these last few months. A special thanks to all the presenters who have shared their knowledge, their wisdom with us. I would also like to thank my co-chair, Dr. Amrita Devi, as well as the international organization partners, George Murimi and Anya Boos from UNODC and Colombo Plan. And of course, I must also thank our chair for this section 3. It has been a great journey over the last few months. We have had very interesting and very meaningful discussions and presentations. We have dwelled into diverse themes within this sub-theme of engaging people with substance use and substance use disorders. And as you can see on this slide, we have covered a vast array of topics. But these are the presentations that we have had. We have had discussions that have gone beyond these themes. People have shared their best practices, the projects that they have implemented, and the kind of collaboration that they have established in these sessions. So just to give you a glimpse of what we have covered over the last few months, we started in November 23. And in the first meeting, we talked about harm reduction, specifically in context of comorbid disorders and communicable diseases. We talked about overdose, particularly opioid overdose, and how these can be reversed. And we were told what kind of international programs are in place, what kind of best practices are in place to help people prevent overdose-related deaths. We started to talk about workforce development because that remains a key resource to strengthen if we want to develop the capacity across the member states on this particular theme. We continued with these themes in our next meeting in December 23, and we focused on how we can invest in developing low threshold treatment services and how we can integrate treatment for substance use disorders and make it a mainstream, primarily at the level of primary care and secondary care. We talked about how nurses can play a very significant and a very critical role in offering these services, both treatment as well as rehabilitation-oriented services. We talked about quality assurance, how we can ensure that the services that we are providing are not only evidence-based, but they also cater to the needs of population the way they need them. So this is what we talked about in December. This year, in the month of January, we focused on populations with specific needs. We talked about programs that are catering to adolescents and children who have substance use and substance use disorders. We talked about interventions for women, what kind of specific programs exist that can be implemented across different member states. And we also talked about LGBTQ population and the issues that are specific to their context. In our last meeting in the month of February, we talked about how we can strengthen global networks around treatment as well as recovery. We talked about how we can establish services that are oriented towards harm reduction as well as treatment and rehabilitation, particularly in those settings that have low income and cater to marginalized populations. And finally, we talked about some specific population groups such as refugees, migrants, and people who require these services in humanitarian settings. So as you can see that we have discussed quite a bit. We have talked about a lot of topics and sub-themes, and it has been a very enriching journey. These discussions have led to quite a number of recommendations, and if I may request my co-chair, Dr. Amrita, to kindly take us through these recommendations.
Thank you, Dr. Yatan. I am very sorry. My apologies that I have to do it on off camera. I sort of switched device and I lost most of the text that I have prepared. As a newcomer here, I am very grateful to be a part of this extensive network filled with professionals from various backgrounds and experiences. And thank you, Dr. Yatan, for allowing me to read the recommendations. I hope I have these recommendations correct because since I have switched device I'm on the road now, I can't open the PowerPoint, but I have the draft key recommendations. That is Sub-Working Group 3.2, engaging people with substance use and substance use disorder. To expand naloxone availability and access, including trainer for active users, first responders, and other groups that are likely to encounter an overdose to prevent overdose deaths and promote post-overdose intervention programs. Develop and implement scalable interventions for the treatment and care of stimulant use, concomitant use, and other emerging drug disorders. Expand access to harm reduction and low threshold services and improve coordination between prevention, harm reduction, treatment, and recovery services, particularly for marginalized communities or vulnerable populations. Adopt national quality assurance systems of care based on the UNODC WHO international standards for treatment of drug use disorders. Build recovery capacity through the establishment of local and regional recovery networks, organizations, and workforce. Develop and implement gender-responsive and women-specific prevention, treatment, and recovery services, and concurrently expand the workforce and the quality of workforce providing these services. These are the draft recommendations that have also been discussed. And are we allowed to open the floor for discussion, Dr. Yatan? How does it go?
Sure. In fact, there are a couple of more recommendations, Dr. Amrita, since the last one that was shared with us. And if you allow me, I can take the group through these quickly.
Oh, thank you so much. Yes, please.
Yeah. So some of the recommendations that have been added include developing strategies to reduce stigma and increase understanding of stigma as one of the largest barriers to care. Recommendation 40 is develop strategies to improve access and uptake of medications for substance use disorders, specifically medications for the treatment of opioid use disorders. And recommendation 41 is to promote a national treatment rehabilitation system and national recovery system with support for local implementation, involving local political authorities, local government agencies, including education, health, social affairs, culture, sports, public security, among others, the community and local state organizations. So these are the recommendations. There are a couple more. Creating and promoting a system for continuity of care for individuals with substance use disorder, including identifying and strengthening each level of care and addressing local needs. 43 is implement systems or mechanisms for recording information to monitor and evaluate treatment services. And number 44 is to promote social integration to foster the consolidation of effective treatment and rehabilitation to contribute to prevention and the reduction of stigma and provide greater sustainability to change. So these are the recommendations that have been proposed as of now, and we would welcome your comments on these recommendations. And of course, if you want to make further recommendations, please feel free to do so. So I can already see 2 hands raised. Can I request Vera to please unmute and speak first?
Thank you for giving me the floor. Let me apologize for not turning on the camera due to some bandwidth issues. As a general comment, I would like to express appreciation for the work group and the co-working group chairs, as well as Brian and the team, for putting together the very ambitious recommendations to address the synthetic drug issue. At the same time, however, we are slightly concerned about the feasibility in terms of resources and alignment with national and international law in the implementation of these recommendations. So we will study the updated recommendations and provide our detailed comments via email. More specifically on the recommendation, I think on the screen it would be number 39, to develop strategies to reduce stigma and increase understanding of stigma. I would just like to highlight that cost, availability, and access are larger first-order barriers that we face. So it might be inaccurate to say that stigma is one of the largest barriers. I will give my detailed comments via email. Thank you very much.
Thank you. We look forward to that. Please do share that. Brian, please.
Thank you so much. Yes, I very much agree with what Vera is saying, that this is perhaps a very broad and ambitious list. And to the extent that we could consolidate some of these recommendations, it would be wonderful. If we can organize them also thematically, I think it might make sense to reorganize or reorder them so that they're a little bit easier to read as they flow. But I just wanted to check with Sarah. Sarah, did we have any additional recommendations to read, or did we get through all of them? So
Brian, I think we are good and we got through all of them. Yeah.
Okay.
For 3.2.
Yes, we got through all of them. So I will say that the West group session got through 3.1, but did not make it through 3.2 and 3.3. So we will leave those recommendations in draft form. We want to hear from the participants of the East session as well. Please continue to send us that feedback, and we will try to consolidate as best we can those recommendations with all of the feedback from the colleagues. I also wanted to highlight a little further, if you could go a little bit further back, Sarah, a couple of slides when those were read, that there had been some changes. One more back, or another one more. Yes, there had been some changes, some eliminations of text for 36 also, based on some recommendations that we received to also raise attention to that. So thank you very much.
Thank you, Brian. George, please.
Thanks, Ethan. Sarah, please move to recommendation number 38. So but my recommendation will be we expand this one slightly to develop and implement age and gender responsive, because I think age is equally important when we're dealing with the issue.
Sure. Thank you, George. Thank you. And in fact, if I may also suggest that in the last meeting, we talked about addressing comorbidities, co-occurring disorders, both medical disorders and co-occurring mental disorders. If we can include them as well as maybe a part of one of the existing recommendations to make it more comprehensive, that might add to the list as well.
Yes, I agree with you, Dr. Yatan. Sorry. I guess the first point on expand naloxone availability, we can actually improve on not just specifically naloxone, but probably other substitution or maintenance treatment, including pharmacological treatment that caters for various psychological and physiological comorbidities. Maybe I can help revise this statement and then get back to your email.
Sure. Thank you, Dr. Amrita. Sarah, please.
Yes, I just wanted to follow up and say, based on the meetings that we've had, I just want to reinforce, like in the West group, we are going to extend the conversation about these recommendations in April. So what we're seeing right now it's a proposed recommendation, they're draft recommendations. And I know that we have to present them to teams around us, but just know that this is an iterative process and we are revising this as we receive input. So I just wanted to make sure that that's out there, that this isn't the final draft yet.
Thank you, Sarah. Any other comments or further additions to this list that somebody would like to suggest at this point?
If I may, Dr. Yatan again.
Please.
Yes. One of the recommendations mentioned about quality assurance that is in line with the UNODC WHO international standard. Indonesia have established the national standard and it has acknowledged award from the national standardization body or national standardization board. If we can actually expand the recommendations, not just tied up to quality assurance, but quality assurance leading to standard of treatment and rehabilitation services.
Yeah, thank you. Thank you so much. We still welcome your suggestions and comments, and please feel free to write to us. As you have been told, these are still in the draft stage and we will be finalizing them over the course of next month or so. So please do write to us. And maybe since we are left with very small time, I think we can conclude this section and I hand it over back to Brian to continue further. Thank you.
Thank you so much. I'm going to begin recording again. Okay, and now I would like to turn it over to the co-chairs of Working Group 3.3, Addressing Populations in Contact with the Criminal Justice System, including Alternatives to Incarceration. From Kazakhstan, Daulat Baipasov, from the Philippines, Arius Manguera. Over to you both for your reflections and recommendations.
And don't let your microphone is muted. You can go ahead, you can unmute and go ahead, please.
Добрый день,
Good
уважаемые
afternoon, esteemed participants in today's session. It's a great honor for me to be co-chairman of one of the working groups. I cannot see my counterpart, co-chairman Aris. I cannot see him. Possibly. Oh, Aris, how do we do it? Will you discuss first the subjects that we considered our sessions, and perhaps after that I will continue with the discussion. Would this work for you?
Sure, Dr. Dula. Good afternoon, everyone. So we started in November. We started with the ATI framework, specifically also in engaging justice, treatment, and NGO policymakers and managers. We also emphasized the stigma and the resilience and inclusive communities, then the human rights dimension in ATI and compulsory treatment system. In December, we dealt with pre-arrest deflection, the significance of the law enforcement and the deflection that early, then the administrative sanctions, so and as well as prosecutorial diversion. This year, January 2024, we discussed drug treatment courts, the best practices, and the practices in corrections and prison. Specifically substance use disorder and mental health in prison settings. So just last month, we had discussion on ATI programs with gender perspectives, juveniles with SUD in the justice system, and the case care management. So Dr. Dulet will expound more on this. Go ahead,
Спасибо,
Dr.
Алис.
Dulet.
Я хотел бы продолжить.
I would like to carry on. Before we open up the microphone for discussion, I would like to say a few words about recommendations that were designed. On the whole, the basic principle underlying them is the universality and flexibility of these recommendations. We understand that the national governments do not have to adopt all the recommendations because the level of development and progress in matters of substance use and abuse and individuals having problems with law vary by the country, and therefore they may be applied on a selective basis. On the whole, I would also like to say that we have 6 recommendations. In red, you can see additions that were made based on analysis of comments and feedback. These recommendations of ours are intended to be universal and cover many aspects of the problem at hand. The first turn, what matters is the normative regulation, and that's extremely important, which needs to be in agreement with national legislation, and any nation that adopts such recommendations need to measure them against the state of national legislation, which may or may not make it possible to implement a certain recommendation. Also, secondly, these recommendations, and that is a very important moment, it is very important that they are geared towards interagency interaction of the judiciary, social protection, health system, justice, law enforcement agencies. The third aspect that I would like to call your attention, I'd like to call the attention of the participants, is that it is necessary to provide science-based treatment and to separately identify rehabilitation development. Rehabilitation being one of the key factors that helps extend remission, and it is prevention of relapses of sorts. And one other thing I'd like to mention is that cross-cutting recommendations that were presented by Sarah are also important, and they are universal, and they fit and they're suitable for many working subgroups. And perhaps this project needs to be finalized by incorporating those cross-cutting recommendations that have been presented to us today, and by doing that, we will improve our project. Now, I would like to open up the microphone for a discussion, please, distinguished participants. I hope that you can contribute to an active discussion, and feel free to raise your digital hand and make your remarks.
Я не вижу пока.
I'm not seeing any hands, any raised hands. Perhaps there are no new suggestions to be made. If there aren't any suggestions, I would like to turn over the floor to you, Brian.
Okay, that's perfectly fine if there are no suggestions. I think this is one area of work where the recommendations are pointing toward the innovation of different initiatives, different alternatives to incarceration. I think some of the work with stigma that is in some of the other sub-working groups also connect, and the cross-cutting recommendations also very much fit into this one as well. So there are, I think, a number of initiatives on the coalition's website that can be implemented in support of these recommendations. And we also look forward to learning what other countries will also be doing nationally in support of these types of recommendations. So From that perspective, what I'd like to do is turn it over back to our working group co-chairs to see if there's any final comments from our colleagues, Secretary Cui and Mr. Starmer, before we wrap up today's session. Thank you to you.
Thank you, Brian. So the Philippine government is committed to support the global coalition to address the synthetic drug threats. And we have actually identified a number of the recommendations among the 50 recommendations and initiatives presented by the 3 working groups, which we deemed effective and applicable in the Philippine setting. We also thank all the participants which actively shared their country's best practices and helped come up with the coalition's recommendations and initiatives. And we particularly thank the U.S. Department of State and the International Narcotics and Law Enforcement Affairs, the INL, for initiating these collaborative activities to address the threats of synthetic drugs. So again, thank you very much for Brian and your team and all, and the chairs of the sub-working groups of Working Group 3. Good day.
And I'll jump in quickly as well. Let me extend also my thanks to everyone on the call today, and indeed all the participants in the sub-working groups on whose considerable labour and efforts and time the point we're at reflects. I think we've made good progress today. We seem to have got consensus on a number of areas. There's a little bit of work still required. I take it from Brian's comments that we may have even overachieved on the number of recommendations that are coming out of this working group, but that rests on, as I said, the hard work that's gone into it from all the participants, the many perspectives and the deep technical expertise that you brought to bear. Noting it's late in the night, DC time, or in fact probably early in the morning, let me extend my thanks also to all of our US colleagues who've supported this process. Perhaps the most practical way in which I can show my appreciation is to keep my comments short so that you can wind up soon. From the Australian perspective, we're very pleased with the progress of effort under this particular working group. We're also pleased, and we acknowledge the involvement of international agencies and civil society. Working across sectors is going to be really vital if we're going to be settling on well-considered and impactful recommendations. There's still some work ahead of us in the lead up to September, but I look forward to working with you all towards that end. Thank you.
Thank you so much. Thank you, colleagues. This has been a real pleasure to be here with all of you. Yes, we are approaching the 1 a.m. time frame in the US, but next month we're going into daylight savings, and so we'll be at 2 a.m. when we're ending our coalition meetings. We are very happy and motivated to be engaging with the Eastern sort of group and being able to connect with all of you and hear from you and learn from you. So despite the time zones, we remain very enthusiastic and energetic as we come into the next few months of sessions. And we'll also be reaching out to the sub-working group co-chairs over the coming weeks to discuss what the program might look like from April to August as we enter this next phase of the coalition's work. Very much want to hear from all of you in terms of, and each sub-working group can have its own sort of direction in how we run these sessions. But so we'll want to, at the discretion of co-chairs, explore how we engage civil society, private sector, universities, and how we are able to represent the presentations from different partner governments as well in the coalition. So thank you all for your time today. Thank you for being able to move through these recommendations. I know there were a lot of them. We still look forward to your comments, and we will do our best to be able to incorporate and consolidate both East and West into a single set of recommendations so we can post those on the website, and then we can start looking at how we operationalize and track progress in terms of implementation of these recommendations. Have a good day, everybody, and see you next time. Take care, everyone.
Thank you.